What is informed consent for ECT and OCD treatment? Imagine making a big decision about your health, but before you do, you want to know all the facts. That's exactly what informed consent for electroconvulsive therapy is about. When doctors consider ECT for treating obsessive-compulsive disorder, they follow a careful process to ensure patients understand what they're agreeing to. This process is a legal and ethical requirement that puts the patient's rights and safety first. First, patients must receive detailed information about what ECT involves. This includes how the procedure is performed, such as where the electrodes are placed on the head, the type of anesthesia used, and how the electrical impulses are delivered. Patients should also learn about the expected benefits, like potential relief from severe OCD symptoms that haven't responded to other treatments. At the same time, they need to understand the possible risks and side effects. Short-term effects might include temporary memory problems or confusion, while long-term effects are still being studied but are generally considered rare. Risks related to anesthesia and the procedure itself are also discussed to ensure full transparency. It's equally important that patients are informed about alternative options. These include medication management, which involves various drugs that can help reduce OCD symptoms, and psychotherapy, such as cognitive behavioral therapy. Patients should understand how these treatments compare in terms of benefits and risks, so they can make an informed choice aligned with their preferences and values. Assessing whether a patient can make this decision is a key part of the process. The patient must have the capacity to understand the information, evaluate the risks and benefits, and decide voluntarily. If a patient cannot do this, consent must be obtained from a legally authorized representative, and additional safeguards like review by mental health professionals may be necessary. Caregivers are often involved in the consent process, unless the patient objects, to support understanding and decision-making. All of this must be documented in writing, following legal standards and ethical guidelines. If the patient's condition changes or if they regain decision-making ability, the consent process should be revisited. In the context of OCD, where ECT is usually considered after other treatments have failed, informed consent helps patients understand why this option might be considered. It explains how ECT could potentially reduce severe symptoms, but also emphasizes the importance of weighing the benefits against the risks. This process respects patient autonomy, ensures they are active participants in their care, and aligns with current medical standards. Overall, informed consent for ECT and OCD treatment is a thorough, ongoing process that helps patients make well-informed decisions about their health. It's about providing clear, honest information so they can choose what's best for them, with the support of their healthcare team. Always remember to consult qualified medical professionals for personalized advice, as each person's situation is unique and requires careful consideration.